Opioid Emergency Response Commission. Dr. Elaine Hishka and Dr. Kristen Klein lead the commission, and we all value the contributions of our strong community voices like Karen Turner, Marlis Taylor, and Petra Schultz. Thank you, Karen, back there, for sharing your lived experience and speaking openly about challenges facing people who use opioids. Petra, it was nearly a year ago today that we stood together here at the Royal Alexandra Hospital as we announced the work to move forward to bring supervised consumption services to this city. You've been a passionate advocate in memory of your son, Danny. And to echo the sentiments that you expressed to all of us that day, if this life-saving option had been available to Danny, he might still be here today. By working with families and individuals directly affected by problematic substance use and addiction-related issues, we are working to build solutions that will bring about change. Today, we are pleased to announce that the federal government has officially approved the first 5 locations in Alberta to offer supervised consumption services. This long-awaited approval means these important, life-saving, harm reduction health services will be offered in 4 locations in Edmonton: at the Boyle Macaulay Health Centre, Boyle Community Services, the George Spady Centre, and for inpatients at the Royal Alexandra Hospital. Because of its strong work with the Inner City Health Program, the Royal Alexandra Hospital is in the best position to allow patients to use their own substances under supervision in a designated, secure area, rather than secretly using drugs without alerting their care team. This will keep patients safe while they remain in hospital to address other medical issues and help keep staff who work here safe. The Royal Alex, as well as the 3 agencies in Edmonton's inner core, have experience working with vulnerable populations. Staff at George Spady, Boyle Community Services, and Boyle Macaulay Health Centre already help people at risk of overdosing and have formed important relationships with people who use substances. Adding supervised consumption services to the umbrella of health and social supports at these sites will help connect people who use substances to these important supports. There, Albertans at risk of overdose may consume drugs under medical supervision and make connections with trained nurses, social workers, and counselors. People who would otherwise use drugs in public, down back alleys, behind dumpsters, along fences, will be able to come to these agencies instead and receive the care and support they need. If an overdose occurs, nurses will immediately spot the signs, provide rescue breathing, and administer the life-saving drug naloxone to temporarily reverse the overdose. We are so grateful for the tremendous work by Shelley and her team, the healthcare leadership and staff with AHS and here at the Royal Alex, and the support of Edmonton City Council, the Edmonton Police Service, and many others as we move forward to bring these life-saving services to this city. The federal government also approved plans by Arches in Lethbridge to offer supervised consumption services there. Lethbridge is one Alberta city that has been especially hard hit by the opioid crisis. So far this year, the city has rates of fentanyl-related deaths that are higher than the provincial average. The application by Arches also received a tremendous amount of support from Mayor Chris Spearman, police chiefs, emergency responders, and citizens. Supervised consumption services in Lethbridge will be provided by Arches in a building that's located close to a shelter, to a dedicated health unit, and to a range of other social services. All of these new supervised consumption services will save lives. They can also improve the health and well-being of people who use the services. Nurses can provide wound care if needed, or refer people to a doctor for chronic conditions such as diabetes or arthritis, among others. Social workers can link people up with programs for food and shelter. and connections to substance use treatment will be available when clients are ready to address the root cause of their drug use. That's because supervised consumption services not only provide a supervised place to use drugs, but can link up at-risk Albertans with the services they need. These members of our community may find it difficult to access traditional health care. They may not have a family doctor. They may have difficulty keeping regular medical appointments due to a lack of transportation, a telephone, or a place to call home. They may feel uncomfortable going to a drop-in medical clinic for fear of being stigmatized or treated poorly. With harm reduction programs like Supervised Consumption Services, we can provide health and social services to people right in their communities. And we can provide a safe place and some comfort and understanding to people who are struggling with substance use issues and who are at risk of overdosing. Evidence shows supervised consumption services save lives. They reduce the spread of infectious diseases. They reduce drug use in public. They reduce the number of needles discarded on streets, in public parks, or in back alleys. And they don't contribute to an increase in crime in surrounding communities. We fully expect that a sixth location in Calgary's Sheldon Schumer Health Centre will also receive federal approval by the end of this month. Coalitions in Red Deer, Grand Prairie, Medicine Hat, Fort McMurray, and Edson are also reviewing their needs to offer supervised consumption services, and a community coalition in Calgary is assessing the need for additional services. So far in 2017, 315 Albertans have died from an apparent fentanyl overdose. These deaths are happening all over our province. And while Edmonton and Calgary have the highest number of deaths, death rates are high in Grand Prairie, Red Deer, Lethbridge, and Fort McMurray. Opening the first supervised consumption services here in Edmonton and in Lethbridge is an important, crucial step, but it is only one of many steps we're taking to deal with this public health crisis. Earlier this month, I announced significant expansion in opioid dependency treatment programs in Edmonton and Calgary. Under that plan, more than 2,000 new patients will be able to access treatment annually, eliminating the wait time in many circumstances. Thousands more will be linked to treatment through specialized community paramedic and outreach teams in both major cities. This spring, we opened 2 new opioid dependency clinics, one in Grand Prairie and one in central Alberta, each of which can take up to 300 patients. And our work will continue. As long as we are losing Albertans to preventable overdoses, we have more work to do. We will continue to work with our health partners to take actions to save people's lives. Thank you.